Hi, my name's Alex Wade and I'm a clinical nurse consultant on the mid-north coast of New South Wales. Thank you so very much for the incredible honour of this award. I feel true gratitude in receiving an award in the name of someone who was so tragically affected by the ongoing health consequences of such a curable virus. It saddens me to think that all these years later, since Cheryl's death in 2011, which was before my time in this arena, that people are still dying from hepatitis C related illness, still suffering from stigma and discrimination in our communities, and they still feel a tinge of fear and dread at the thought of treatment, and occasionally still feel unworthy of these amazing new medications. I recently listened to a book about the war on drugs called Chasing the Scream. And after only a few chapters in, I found myself unable to comprehend the beginnings of such a crusade. The ruthless pursuit of the Lady Billie Holiday in the 1940s is gut-churning in its relevance today. This inspiring and talented artist was hunted down by the recycled prohibition hounds for her marijuana, opium, cocaine and heroin use, with their lingering hatred on public alcohol consumption. Once when she was arrested and sent to trial for narcotics, she actually asked to be sent to rehab, but was sent to prison and forced to detox alone in her cell. When she died in 1959, the Narcotics Bureau were literally knocking on the door of the hospital trying to arrest her once more for possession and use of illegal substances. However, she was saved by the tragic and fatal failure of her liver from cirrhosis due to years of heavy alcohol use. And this scene is somewhat reminiscent of the infamous witch hunts of Salem. I don't begin to claim I can comprehend the complexity of such things. However, I do know that when people are pushed to the edge of society and shunned, hunted, we wither, our souls suffer. A child untouched fails to thrive, and trees unnurtured cease to grow. I had my own dark nights of the soul and self-imposed isolation that were a part of my early life, feeling the blame of my situation, the shame, the hopelessness. My experience and subsequent transition into the light of this life some 30 years ago has opened me up, transformed me, and I believe given me the drive and the duty to carry the torch and at times ring the bell of action. If you know, you know. I came to the Mid-North Coast team in 2014 with no real idea of what I was getting into. I had primary health experience as a sexual health practice nurse and had come to nursing later in my life after having children, and previously worked in horticulture as an arborist and a general farm hand, fruit picking, working in huts and stuff. So it was a very different environment. The Mid-North Coast Liver Clinics was, when previously known as Clinic C, was my launching pad. Working alongside Sally Spruce, who introduced me to the wonderful world of viral hepatitis. Thank you, Sally. And hepatitis C was still in the interferon and ribavirin stages at that time, with the dubious inclusion of drugs like boceprevir and telaprevir, with terrible side effects and still not great outcomes. I feel really blessed to have been a part of the new wave of treatments that were aptly labelled the tidal wave. And 2016 was a hell of a ride, especially for someone like me who doesn't surf. I went on to broaden my experience by working alongside the amazing Jana Vanderjagt, nurse practitioner, who quickly became my clinical mentor and still is to this day. And a big massive thank you to Jana, always, on the Hastings Macleay Liver Clinic at the time. The team there showed me an inclusive and innovative way of doing hepatitis C assessment and management, and Jana had established the no wrong door approach, which I absolutely love and uphold to today. And she had built the delivering integrated care CNC role with the Mid-North Coast Drug and Alcohol Services. And this is the role I stepped into in 2017 during a period of staffing flux, with some trepidation and much support, thankfully. Support which I have continued to get from my manager, my friend, my work wife, Jenny Heslop, There has not been a day when I have not known that this woman has had my back. I'm fairly sure she saw the fire in my belly and had to learn quickly how to manage it, of which she has done with great skill, love, and the occasional reining in of an overly zealous energies and innovative ambitions. In 2019, I was tasked with the restructuring of our 2 clinics into the current Mid-North Coast liver clinics. During this time and since, I have reached out to colleagues far and wide, established new mentors. You may or may not know who you are. I've made friends and discovered amazing colleagues that inspire and challenge me to be more than I believe I am capable of. One of the North Coast Public Health's previous directors called me a troublemaker during COVID when I refused to stop attending the homelessness services to provide care and flu vaccinations. Opening up new relationships for future testing opportunities is what happened from that. Also, the director of the Mid-North Coast Drug and Alcohol Services once introduced me to our new incoming medical director as, "This is Alex, she's the integrated CNC and she's a live wire," to which I felt and continue to feel great pride, because this is who I am. This is who we are. This is how we are. This is what makes us effective. Passion, commitment, compassion, dedication, innovation, effective communication, and are willing to go the extra mile. However, I'm not really sure how I ended up here receiving this award, but I do know that the people I work with and the people I do the work for are extraordinary. It's they who deserve awards. My team, the admin staff, the nurses, and of course the medical staff who go above and beyond every day to meet our clients where they are at, to find ways and means of helping someone access care and treatment, sometimes in their darkest days. It's the determination, yes, incredible resilience of a community of people who have been outcast and ostracised since the days of Billie Holiday. May she sing her songs in heaven, that take the risk to trust us enough, believe that maybe we mean to help, not hinder, to assist, not arrest. So I just want to thank you, all of you, and whomever nominated me for this beautiful, privileged award for supporting our great work in the field of viral hepatitis. You shine the light for those clients, those punters, those friends who I have met, I've loved, and I've lost in a short time. I've worked in this area, and I pray that we can meet the New South Wales Ministry of Health targets by 2028. Not for the sake of the bloody targets, but for the sake of the people. Please know that although this has been awarded to me, I am accepting it on behalf of my team on the Mid-North Coast. These people, these legends, they are making a difference in people's lives in a way that the general medical and nursing fields would have no idea about. Their tireless and humble services to the communities we work with inspire me every day to keep finding ways to reach those we haven't yet and to be innovative in the ways we do what we do so well. Much gratitude and the greatest respect to you all. Thank you.